morning, I'm Dr. Darina Kamarudin. I'm the Head Medical Officer of the Cancer Health Screening Center from National Cancer Society of Malaysia. Alright. The stages depending on one is the size of the tumor, and two is the how much or how many lymph nodes are being affected, and also where has it spread to the other parts of your body. So for example, if you are in stage 0, meaning that the cancer cells is just in the ducts, meaning it's just at one side. It has not gone to any other part of your body or any surrounding area of the breast. If it's stage 1 or 2, depending on how much or how are the sizes of the lumps. For example, if it's below 2 cm, and it's not involved any lymph nodes, then if it's at stage 1. If it's at stage 2, meaning that the lump has grown bigger from 2 to 5 cm and it has involved partly 1 or 2 of your lymph nodes at your armpit. Now stage 3 and 4 is basically when the cancer cells has already spread beyond the breast, meaning that it has spread to either 1 or 2 or more organs. For example, your brain, your bones, your lungs, or even your liver. Now, depending on how extensive is the cancer on the patient, will decide on the treatment. Most of the time, if the lumps are big enough or it is quite extensive, we will try to remove the lump first, meaning by doing a surgery. So the surgery, depending either it is the whole breast is being removed, which is known as mastectomy, or a very smaller type of surgery which is known as lumpectomy, meaning that you just remove the lumps which are cancerous. After the surgery, usually it's a combination of either chemotherapy, radiotherapy, or hormone treatment. Now, depending on where has the cancer cell spread, it could be a combination of all those three. That means chemo, radiotherapy, or hormone therapy, or it could just be only chemotherapy or radiotherapy or only hormones. Now chemotherapy basically is a therapy where you give a drug or some sort of 2 or 3 types of drug which are very how should I say, is very strong enough to kill the cancer cells. So with the chemotherapy, you put an IV line, meaning that you go through your venous line, and a patient will receive it through many cycles, depending on how extensive is the cancer. So a patient will go through all those cycles, and if the cancer cells has stopped, then we will either proceed to another treatment or we stop at that treatment. The next treatment is radiotherapy, meaning that giving a radiation, a high intensity radiation to the cancer cells. The next therapy is hormone therapy. Hormone therapy is depending on how much estrogen hormone there is in a patient. For example, if the estrogen hormone is too high or if it's not, then we decide on how to give this hormone therapy to the patient, maybe about 5 years or more. So a patient who has completed this chemo, surgical, radiotherapy might have to go on this hormone therapy. Now the side effects of each treatment, of course, there is for few of them, and also it depends on how patients' reaction to the treatment. Some might have some falling of the hairs, for example, for chemo. Some might have some blackish skin affection on the skin, especially when you do the radiation. And some with those from hormone treatment, they might have some mood evolution, reduced weight, and so forth. So all this has its little bit of side effects. Well, we always say that prevention is better than cure. We always would like to stress on 3 things. One is your own self-breast examination, meaning that you screen for yourself every month, a day after your finish period, by doing your own self-breast examination. That means checking your breast on your own to see if there's any lumps or any obvious changes that you could see when you do your own self-breast examination every month, a day after you finish your period. Secondly, it's a clinical breast examination where we will advise ladies, especially 18 years old and above, or especially if you already have kids, or even if you're above 20s and 30s, to come to the clinic to let the doctor, for example myself or my colleague, to have a breast check by a doctor at least 2 years once or once a year. For those who are below 35 or 40, we'll advise you to do an ultrasound. This is more on the investigative part. That means you do an ultrasound of your breast to see if there's any lumps. For those above 40, we advise them to do mammogram, which is an x-ray of your breast. So if you do this screening, you can prevent cancer as early as possible. As I mentioned again and again just now, prevention is better than cure. If you detect your cancer at an early stage, as for example stage 0 or 1, your survival rate is much better, which could be about 97 to 100% if you detected it early. But if you detect your cancer at later stages, for example stage 4, then your chances of survival rate is much lower, maybe less than 25%. On you having breast cancer, definitely. For example, if your family, meaning that your sister, your mother, or your auntie, your first degree relative has breast cancer, your risk of having a breast cancer is there, but it's only about maybe 10 to 20%. 85% of those ladies who have breast cancer do not have family history. So family history only contributes about maybe 15 to 20%. Now, if you ask about the hormone relationship to breast cancer, yes, especially it is all related to your hormones. If you have an early menses, early menarche, the first time that you have your period, as early as 11 years and below, meaning you have your first menses at the age of 9 or 10, then your risk is slightly higher. If you have your first baby, your first live birth at the age of 30 years and above, that means your reproductive system starts after 30, you had your first baby after 30, your risk is slightly higher. If you have your menopause later, very late stages, above 55, then your risk is also slightly higher. So basically this is all those risk factors that are related to breast cancer, which as I mentioned just now, hormones, family history, and your reproductive systems, and also when you stop your menses. But remember, there are also other risk factors that could have an influence on you having a breast cancer. For example, if your diet is more on the red meat, more on all those proteins, but less on fruits and vegetables, your risk is slightly higher, especially if you're obese. Because when you're obese, your hormone estrogen goes a little bit higher, and that causes the risk of having cancers, especially breast cancer. You also have to remember that if you take too much of alcohol, you are also putting a risk on yourself. If you smoke, or even if you do not smoke, if you're around person who smokes, for example, you are a passive smoker, second-hand passive smoker, then you are also at risk of having a breast cancer. So the other risk factors you must not forget is all the environment, the chemicals reaction on your body, and all those those small preservative that can cause cancers to you. So all this has an effect of you of having a risk factor of having breast cancer. Yes, definitely. We are seeing a shift of ages. For example, 60% of all those breast cancer in Malaysia currently is between 40 to 50 years old. But we could see that the shift is going to be shifted earlier, meaning that we could see younger patients, younger ladies are having breast cancer nowadays. You'll be surprised that we have seen cases as young as 5 years old girl having a breast cancer. It is through a nipple discharge, which is bloody. And you could see also there's an uprising trend, especially in those ladies which are lactating and pregnant ladies having breast cancer in Malaysia. Why? Well, if you were to ask any doctors, they will say there are many factors that causes you to have risk factors of breast cancer. So yes, if you were to ask me if there is an increase of patients having breast cancer, yes, especially in all ages. And the good thing is that if you screen early, if you educate these ladies early, they can come forward to do the screening, and we can prevent this death in breast cancer. But if you don't, if you are fear of knowing, if you're in the denial stage, you think that it will never happen to you, that's where we see those late cases in Malaysia. The patient reaction when we break out the news of them having breast cancer, well, I could say that most of them, maybe 80% and above, are in shock. One is because they have never expected that they're going to have breast cancer. Please remember that cancer can affect any ages, any sexes, or any race. So the first reaction that we could see from them is the fear of dying, and they are shocked, and most of them are in denial stage. Some of them could not accept that they have breast cancer because they think that they live a healthy lifestyle. But remember, cancer can affect anyone without any symptom. It's just like a silent killer. So what we do with these patients who have this news, we will always tell them that this is not the end of the road. There is still some treatment could be done. We could still do something to treat for this cancer. First, for example, we tell them the options that they can take. Either they do a surgery, or they need to do a biopsy first, and then they need to do all this, go through all these treatments. And we will always tell them to see on the brighter side, meaning that it is like a wake-up call for them. And we always say that there are many people who survive breast cancer. So counseling is very much important in this type of patients, and so most of them we will let them to speak to some of our support group, which are all our survivors, to give them the moral support. In terms of other support, for example, treatment and so forth, we usually in National Cancer Society, we do give them the options as well. As a doctor, as a lady, as a mother, as a daughter, I will advise all ladies out there, please go for your early screening. When I say early screening, meaning that you do your own self-breast examination diligently every month. Alright, do it at the end of your menstrual period. Ladies, do go for your ultrasound of your breast. Let's say if you are 18 years old and above, do your ultrasound even if you are below 35, and do your mammogram when you reach 40 years old. Do it every year or 2 years once. There are myths out there saying that the mammograms are painful. They are not, as compared to when you have a breast cancer and for you to go through all those treatments. The radiation that is being exposed by doing a mammogram is just like taking 1 or 2 cigarettes, so it's not even dangerous at all if you see the benefits and the pros and the cons. So just do your mammogram. Forget about the pain for a while. It's only about 10 minutes or 5 minutes pain, rather than thinking of you having the breast cancer later on. So ladies out there, get aware, be empowered with knowledges regarding breast cancer. Do your screening early.
It was in May 1st, 2006. I get a feeling that I'm feeling tired, and doing the housework, I called my husband, and since my husband to feel what's wrong with me and my breast. And when she felt it, and she found out that she get a lump, and I do not know about anything about it. And when she found out that I get a lump, he told me straight away that the very next day we are going to see a doctor. And after that, seeing a doctor on the following day for University Hospital, and the doctor told us that if you need the fastest, the better. So they give us a letter for the other hospitals for further tests. And before that, so we found out with other doctors from his friend who is a doctor to do it faster and to act fast. So we seek the advice from this doctor. We went to Cancer Nilai Institute for the further tests like biopsy, mammogram, and X-ray. And from then, they found out that really is a cancer. Then my husband went there to pick up the report, and he says that the best option is immediate removal. Then after that, we went back to his friend, and before we went to see this Nilai Cancer Center, one of our friends who is a colleague of mine last time when I was working before, to go for this Mr. Bomo. I don't know whether Bomo is a doctor from Kampung.
Primitive medication.
And after that, he says, when on the way back, on the way there, we stopped and she talked to me regarding this, whether it's very want to rely on that doctor or have to change my mind. Because once you go there, yes, you can take out, you can heal fast. But once you go back, it's another treatment again, another go back again until going home. So so we went back home and changed the next day. And the very next day we went to see a friend. That's why we landed to Cancer Institute. Then all the final things, so we go back to his friend. Then he gave us a letter to see the general hospital. And the very next month, the following month is June, do my operation. And the doctors is really that general hospital did it very nice treatment that I have. And after that, I stayed there for 3 days. 3 days. Then the following month, remove my lymph nodes. It was really cancerous. Then my pillar of strength is my husband. My pillar of hope is my husband. He's the one who helped me a lot, and she teach me how to cope with it, how to deal with it, to handle with it. Even at this point of time that I'm really have that emotional, whenever I remember all those days, even though it's 7 years now already, still I had a feeling of fright a little bit. But because of the pillar of strength, pillar of hope that I have until now, this is my husband now. During my my treatment, I get a feeling that sometimes it's like unlike others do the chemotherapy. I have the totally loss of hair, but mine I don't have the total loss of hair because mine is only radiotherapy. It's a lot of hair and blackness of the nails, dry of skin. My husband teach me how to eat vegetables because I did not eat any. For me, the vegetables is only my eggplant, long beans, cabbage. But now, I eat all of these things. During my treatment also, one important thing is make fruit juice. He bought the